The title of our program today is Assessing GLP-1 Impact on Hair Loss. And as I'm sure many of you in practice, whether or not you are offering any sort of weight loss strategies for patients or not, you have heard from your patients that they are having potentially some different side effects that are reported or may not be reported. And today we have Dr. Arisa Ortiz, who will be talking to us. She is with UC San Diego. She's a Harvard-trained dermatologist. She's just one of our absolutely very favorite people. We've been working with her for about 5, 6, maybe 7 years now. And she has a wealth of information. She is one of our SmartGraft physicians as well. So she runs the gamut of all, not just assessing and typical dermatological treatments, but she also is involved with surgery as well. She's extremely well thought of by her peers. You may see her at various conferences on the podium, speaking panels, and we are delighted to be able to have her here with us today. So I am going to turn this over to Dr. Ortiz, and let's begin the webinar.
Thank you so much for your kind introduction, Cindy, and thank you so much for having me. I'm really excited to be here with all of you today and talk to you about a very hot topic. I think GLP-1 agonists have really transformed the weight loss industry. Obviously, they're so effective in promoting significant sustained weight loss, and there's so many benefits to these medications. We're seeing improvement in atherosclerotic cardiovascular disease, reduction in stroke and certain cancers, improvement in chronic kidney disease, and even reduction in anxiety and depression. So these drugs have quickly become very, very popular because they are so effective. But just like any medication, there's always risk of potential side effects anytime you're taking something systemic. And so because these medications have been so popular, supply has really been an issue. And we've seen, these kind of spa-like clinics pop up prescribing these medications, and they're actually trying to compound non-prescription medications that are somewhat similar, but not Ozempic or Wegovy or the GLP-1 drugs. And so patients really need to be careful because these are not FDA approved, and they can potentially have contaminations in them. They're not verified. And so the FDA actually put out a warning that they can't verify the safety or effectiveness of these compounded medications. So that's a whole other issue, but it just goes to show how popular these medications have been. So some of the side effects that we've seen have been like loss of muscle, aspiration risk with anesthesia because it can delay gastric emptying and colonic transit time. And so this can lead to regurgitation and aspiration of food into the lungs. And so aspiration risk with anesthesia has been seen. More commonly, we've seen like abdominal pain, constipation, diarrhea, nausea, and vomiting. And then gastroparesis has also been seen, and pancreatitis. But one thing that's interesting is that in the clinical trials, only 6% of patients reported hair loss at the highest doses. And I think that that's probably underreported because I know in my clinic, I've been seeing more and more patients come in on GLP-1 agonists complaining of hair loss. And so patients may not have understood the association with the medication and hair loss because it happens so many months later. So I have a feeling that that percent is probably underreported. And so is the hair loss due to the medication itself? Is it due to the rapid weight loss? Is it due to the nutritional deficiency? We really don't know, and maybe it's a combination of all of it. But this patient was on GLP-1s, and she was really doing, a good job of trying to eat healthy, a balanced diet, to address the nutritional deficiency that can come with taking GLP-1 agonists. So if you look at her starting weights, she was really only losing an average of 4 pounds a month, and that's what's recommended, about a pound a week. But 6 months later, she did report significant hair thinning and hair shedding, which is consistent with telogen effluvium. So we know increased shedding occurs 3 months, sometimes 6 months after rapid weight loss or any stressful events. Usually this is temporary, not always, but it's usually temporary. But it's just a conversation we need to have, like, what is the cause of the hair loss? Because I think we are going to be seeing this more and more frequently. So telogen effluvium is essentially when patients have increased shedding, and this is because the hair follicles enter a resting telogen phase in the hair growth cycle, and so that leads to the shedding. And there are many triggers, but well-known triggers are rapid weight loss, medications can cause this, nutritional deficiencies. So it may be a combination of all of it that is causing patients on GLP-1 agonists to have abrupt hair loss. Of course, there's other causes like cancer treatments, illness, any kind of stressful events, surgeries, traumatic events, hormonal issues, infections, toxins, things like that. So it's a conversation that we need to have with our patients, and it's important to set realistic expectations and know how to counsel them. So it's important that they understand this may be a potential side effect on GLP-1 medications, but we should reassure them that usually hair loss is temporary, and it's not such a rare thing. It's pretty common, and hair does take a long time to grow back, as we know. So we have to set realistic expectations that hair regrowth is gradual and can take 6 to 12 months. And patients really can be impatient with that sometimes, but if they know what to expect, then I think, they're more patient. But if they think it's going to regrow in a couple months, then they tend to get disappointed. So setting expectations is very important. And then, there's definitely a psychological impact on patients when it comes to hair loss in both men and women. But I think it's important to reassure them that their health and their well-being is really the primary goal here. And the hair loss, while it can be challenging and distressing, it is manageable, and we have many ways that we can manage that. So it's important, just like with anything else, that we have follow-up appointments so we can monitor their progress and adjust treatment plans, especially because hair loss does take so long to regrow. So medical management, I'll tell you, in my practice, a lot of patients are really resistant or hesitant to start oral medications. They're really wanting more like holistic treatments. They're wanting, more natural treatments. And so while these are good options, many of my patients really don't want to take these anymore. So minoxidil has been around forever. Oral minoxidil has been in the news a lot recently, and I'm not sure why it's so trendy lately, because it's been around forever, but I've definitely had patients come in asking about oral minoxidil. I personally don't prescribe it because I'm very risk averse. So if you're thinking of prescribing it, you would start at 0.25 milligrams daily, but there is a risk of pericardial effusion. And while that is very rare, I'm just very risk averse. And so I've also heard of cases of periorbital edema. And so I prefer topical minoxidil. So topical minoxidil, the foam formulation tends to be more tolerable than solution, can be more irritating. And I just do the 5% men's foam. Interestingly, the women's 5% foam is more expensive for some reason. So I just recommend the men's 5% in all of my patients. And once a day is enough. Studies have shown that once daily is just as effective as twice daily, but compliance is better. And patients need to be on it for 9 to 12 months before they notice a difference. So again, hair does take a while to grow. Finasteride, has been around for a while and is pretty safe. It works by reducing DHT levels. It's 1 milligram daily, and you can use it in women if they're postmenopausal, but I would avoid it in premenopausal women. The side effects can cause decreased libido, gynecomastia, and again, while this is rare, it can be serious. So post-finasteride syndrome is when patients are off the meds and then have signs of depression and sexual dysfunction that sometimes is irreversible. So again, I usually don't prescribe oral medications in my practice, but it's certainly not wrong to do that. And while it doesn't cause an increased risk of prostate cancer, it does increase the Gleason score, and so I would avoid it in anyone with a family history of prostate cancer. Spironolactone can be effective in women with PCOS, and so it acts as an anti-androgen that can reduce hair thinning and stimulate hair growth in women. But most of my patients really are looking for more natural treatments, so nutritional support, a balanced diet or vitamin and mineral supplements. So things like biotin, zinc, vitamin D, iron, omega-3 fatty acids can help to support hair growth. Scalp massage, topical treatments like rosemary oil, peppermint oil, castor oil. Of course, stress management, we all need that for everything. So that's good for everything. And then hairstyle modifications, we know that tight braids can cause like traction alopecia. So, trying to avoid like hair extensions and things like that. Low-level laser therapy is really an interesting topic. So photo biomodulation is, I think, kind of early in its research, and we're learning more about it. But it seems, so red light is where I would focus here in terms of hair growth. And red light stimulates mitochondrial activity and increases the energy of the cells to stimulate hair follicular growth. So I think that's a really interesting field and seems promising, but we're still kind of learning the optimal parameters for that. Microneedling is sometimes helpful. And then PRP, while that's not FDA approved, definitely can help to stimulate hair growth. A lot of patients, though, don't like the injections and they don't like that they have to keep coming back, but it is a natural alternative. So, with GLP-1 hair loss, so telogen effluvium will grow back, but what's happening in these older patients is a lot of times it's unmasking more androgenetic alopecia. And then in that case, it's more permanent. And when you have permanent hair loss, you can do some of these other medical treatments or natural treatments, but it's not really going to change the hairline. So if a patient is looking at like improving their hairline and something that's more permanent, then really that's where SmartGraft plays a key role. So SmartGraft, like Cindy mentioned, I've had for several years now, has really been such a great part of my practice because you can really like transform someone's look. And it's so minimally invasive that patients can go like right back to work. Usually, I mean, they might take a couple of days off, but they're usually back to work within a week or less. And there's really like not a lot of healing. There's not a lot of downtime compared to like the traditional methods. They don't have to worry about sutures. They don't have to worry about infection. It's really like a lot easier and more elegant of a procedure. The scarring is so much more acceptable compared to like the strip method. And so this device really allows for like a precise customizable treatment, faster recovery, higher graft survival rate because of the way the system handles the grafts. So they're chilled and they're kept moist so they don't dry out. So, I mean, I've had so many more patients come in asking for this, asking for hair growth treatments after GLP-1. And I think you'll all start to see that as well. And so SmartGraft has really picked up in my practice. And probably a lot of it is because of these GLP-1 patients. And so this is the system. You can see it's super ergonomic. It fits real easily in the corner of my room. And, you know, the results from these procedures are super natural. You really can't tell. Patients are very happy with it, and they like that it's permanent. It's not something that needs to be repeated over and over again. I'm going to show you a procedure here. So actually, before I do that, let me just show you this. This is one of my patients 2 weeks out. And so you harvest from the posterior scalp, and if their hair grows over it, like if they don't keep it short, then you don't see the scars at all. But you can see, you know, it's pretty short, and you can kind of see as the hair grows back where the scars are, but they're so teeny tiny that they're almost like barely perceptible. So it's not quite scarless, but pretty close, especially compared to the strip method. But here you can see me performing a procedure. So the handpiece is really easy to use. I'm extracting each individual follicular unit one at a time. And so you can see the scars are less than 1 millimeter. It's the handpiece kind of spins, so it's really easy to extract. And then the grafts go through the suction tube into the little canister that keeps them chilled and hydrated. There's a wash every few minutes that sprinkles them so they don't dry out. Then you create the recipient sites, and then you place each individual graft for a really natural hairline. So, you know, obviously the plugs isn't a great look. So this is just so natural. And has been a really great treatment in my practice. So here is one of my patients. You can see before and 7 months after. So full hair regrowth can be up to a year. So he's going to continue to get better and better, I think, because this was at 7 months. But you can already see the great results. And again, a really natural hairline. And, you know, he barely had any healing time. It's just a super easy procedure, and it's fun to do. And this patient, I think Cindy's going to be talking about this patient, but now with the use of exosomes, we're seeing even quicker results. And I think, you know, patients can be impatient. They want their results right away. So she's going to talk more about this, but I think, you know, we have ways that we can speed up the results as well.
Thank you so much, Dr. Ortiz. I loved watching that procedure. I have seen you do the procedure myself in the office, and I love, you're just so fluid with it. I love seeing it. So we're going to take, I'm just going to take a few very quick minutes to explain to you some of the additional solutions that Smart Solutions RX, which is our sister company to Vision Medical, some of the other additional solutions that we have for anyone who is looking to build a total hair clinic. And then at the end, we'll save a few minutes for some time for Dr. Ortiz to answer some questions. But what we have found is that using a multimodality approach in hair restoration seems to work best because there are multiple causes, as Dr. Ortiz mentioned. And that way, when we're approaching as many as we can, we're, you know, kind of hitting as many as is possible. So Smart Solutions has created a full system, including nutraceuticals, which we now call hairceuticals. And those obviously are for home use. We have some wonderful clinical studies with them, some fabulous before and afters that show great results. And it's a great alternative for those of you offices who may really be interested in doing something other than you know, some of the other more popular products. Some of you may be using Nutrafol or some other things that are kind of everywhere out there now. One of the nice things about the LockerX line is that it is very individually, you have the ability to create your own system within the system. So as an example, for instance, we have block, guard, and defense. And our block comes with or without collagen, so it's vegan or not. And then it also includes a GARD system, which is a B vitamin stack that you can get with or without biotin. And Dr. Ortiz likes to use it without biotin in her office. So we have a lot of different solutions, including access to some wonderful low-level light therapy that she touched on with some caps. We also have regenerative medicine options, which we'll touch on at the end. Smart XO, which is our amnio-derived exosome solution for topical use. And we also do growth factors, so they can be used both in the clinic as well as at home. And then, of course, hair surgery is the final option. So here we have actually a glass of our defense, which is a really great solution and complement to the GLP-1 therapies. And the reason that I mentioned this, again, I said, if you would fill this post-survey out, we're going to send you as a gift one of these jars of melon defense with a frother. And I just like to mention this because it's part of the full nutraceutical or hairceutical program. And it's really important because it hits all of the nutritional categories, including plant proteins and all of the minerals, over 120 minerals and vitamins from a blue-green algae, spirulina, actually. It's excellent for gut health, but it really can be the building blocks for any of these patients that you're seeing who just can't get enough of the right nutrition rapidly enough and assimilated enough in order for them to start the hair pathway again. So our at-home products include the oral nutraceuticals, some shampoos, growth factors, scalp treatments, handheld devices. We also even have a camera for your office that you can use for some diagnostic purposes to count your hair follicles. You can use it for baseline. And as Dr. Ortiz said, it's really important to do monitoring and follow-up. So you can then continue to see the progression, whether it's with your surgery, whether it's with low-level light therapy treatments, nutraceuticals, growth factors, topical exosomes, whatever the choice is, or the combination of those, you'll be able to follow that in your hair clinic. And lastly, we have growth factors, which of course are different from the biologic exosome. So our growth factors are actually biomimetic. They're grown for us. They come originally, they start as a human growth factor, and we select those growth factors that we feel are most important for the hair pathway. It's a simple way to boost a treatment that you may be doing in the office, such as PRP, if you want to add a very combined amount of growth factor to that treatment to ensure a better outcome. It can be used at home for a patient as well. And then in addition to that, we also have our exosomes. So our biological division, we started with an amnio-derived solution. It is an 8 ml solution. It contains over 100 billion acellular and non-expanded exosomes from the amnio solution. And we specifically qualify it and quantify it for the particular microRNA for hair. So it can be used, again, topically. We've used it in our or here's an example, as a matter of fact, let me go back to this. This is the use of this in showering the grafts during a hair surgery. And you can see that this particular patient, now this doesn't happen all the time, but this particular patient hardly had any shock loss once those grafts were actually implanted. So this is the patient at 30 days, which is pretty amazing. And at 5 to 6 months, he has what appears to be almost full growth. So much more rapid. And as Dr. Ortiz mentioned, patients, don't want to wait. They want it now. And so this is a great way to help them along that pathway a little faster, very much more rapid growth, very healthy growth. The exosome can also be used topically in the clinic for a treatment along with microneedling as well. So it's a very affordable solution to help your patients along that pathway. And again, I just like to mention that we feel that the best outcomes are going to be done with synergistic effects will happen with your multiple modalities. Well, thank you so much, Dr. Ortiz.